Hello everyone. Today I'm going to discuss some basic points about development of female reproductive tract. First, I'm going to tell you about the development of gonads. The fetus is bisexual till the age of 6 weeks or 6 weeks of gestation. That means the fetus is sexually undifferentiated till the age of 6 weeks of gestation. So this sexual differentiation starts to occur after 6 weeks of age. The genetic sex plays an important role in sexual differentiation. That means whether the baby is XX or XY. The presence or absence of Y chromosome plays an important role in sexual differentiation. If Y chromosome is present, the genital ridge is converted into testes. If Y chromosome is absent, the genital ridge will be converted into ovaries. What is the importance of this is in the fetus, both Mullerian duct and Wolffian ducts are present. Mullerian duct is also called as paramesonephric duct, whether Wolffian duct is called as mesonephric duct. So both the ducts will be present in the baby. So if Y chromosome is present, the genital ridge will be converted into testes, and if absent, it will be converted into ovaries. So these testes will be having Sertoli cells and Leydig cells. Sertoli cells secrete an important hormone, that is anti-Mullerian hormone, and Leydig cells secrete testosterone. This anti-Mullerian hormone inhibits the development of Mullerian duct because Y chromosome is present, so testis is present, it is going to be a male baby, so there is no need of Mullerian duct development in this baby. So the anti-Mullerian hormone which is secreted by Sertoli cells will inhibit the Mullerian duct. That means the Wolffian duct will develop normally, but the Mullerian duct is inhibited by this hormone. So there is no development of uterus, vagina or fallopian tubes in case of male baby. So and now come to the testosterone which is secreted by Leydig cells. This testosterone is converted into dihydrotestosterone. Sorry, dihydrotestosterone by an enzyme called 5-alpha reductase. What is the importance of this is this dihydrotestosterone is essential for formation of male external genitalia. With the help of this dihydrotestosterone, the urogenital sinus is converted into male external genitalia. Now come to the case of ovaries. Here Y chromosome is absent, so the genital ridge is converted into ovaries. Ovaries do not contain Sertoli cells, so there will not be any anti-Mullerian hormone. No anti-Mullerian hormone, so the Mullerian duct will develop normally and it will be converted into uterus, vagina and fallopian tube. And there are no Leydig cells in ovaries, so there will not be any testosterone secreted from the ovaries. No dihydrotestosterone, so the urogenital sinus is not converted into male external genitalia, rather than it will be converted into female external genitalia, that is the clitoris and labia majora and labia minora. I am going to tell you about the development of Mullerian duct. There are two in number. It is also called as paramesonephric duct. So this is the cranial end of the Mullerian duct and this is the caudal end of the Mullerian duct. The cranial ends will not fuse, they remain unfused and they will be developed into fallopian tubes. The cranial ends of the Mullerian duct will develop into fallopian tubes, whereas the caudal ends fuse and they will form the uterus and the vagina. Initially, there will be a septum in between these, so gradually this septum will disappear or disintegrate and forms a cavity. So these caudal ends will gradually develop into uterus and the upper part of the vagina. That means the upper two-third of the vagina, not the complete vagina. The lower third vagina will develop from the urogenital sinus. Fusion of Mullerian ducts is completed by 12 weeks of gestation and canalization of both uterine cavity and vaginal cavity is completed by 20 weeks of gestation. So now I will tell you the development of external genitalia. The external genitalia will develop from urogenital sinus. So imagine this as a cloaca. This cloaca is divided by a longitudinal septum into anterior part and posterior part. This anterior part is called as urogenital sinus or developed into urogenital sinus, and the posterior part is developed into rectum and anal canal. So this urogenital sinus is having three parts: the cranial part and the middle part and the caudal part. This cranial part of the urogenital sinus is developed into urethra and mucosa of the bladder, and the middle part is developed into lower third of the vagina. Previously, I told you that upper two-third of the vagina is developed from Mullerian duct. Now, the lower one-third of vagina is developed from the middle part of urogenital sinus, and the lower part or the caudal part is developed into urogenital membrane. This urogenital membrane later developed into clitoris and labia majora and labia minora. As I told you before, the lower part of the urogenital sinus is developed into urogenital membrane. This urogenital membrane is having three parts: genital tubercle, genital folds, and genital swelling. Genital tubercle may be developed into clitoris, and the genital folds will develop into labia minora, and the genital swellings will later develop into labia majora. So this is how the external genitalia will form from the urogenital membrane. Here is the conclusion of development of female reproductive tract. First, genital ridges converted into ovaries. Ovaries don't have Sertoli cells, so no anti-Mullerian hormone secreted. So the development of Mullerian duct is normal. It is developed into fallopian tubes, uterus, cervix, and upper two-thirds of the vagina. And urogenital sinus, which is a part of cloaca or which is developed from the cloaca, is converted into or developed into mucosa of the bladder, urethra, and lower third of the vagina. And urogenital membrane, which is a part of urogenital sinus, is developed into female external genitalia like clitoris, majora, and minora. Genital tubercle is converted into clitoris, genital swellings will be converted into majora, and genital folds will be converted into minora. So, thank you.